Hospice care at home is for patients that have a terminal condition, which is a life expectancy of 6 months or less. When a doctor gives you a terminal diagnosis, whether it is end-stage Alzheimer's, end-stage Parkinson's, general debility, cancer, or adult failure to thrive, where you're just not getting better, you're just declining. And a doctor has to certify that, given his best guess, that you have a life expectancy of 6 months or less. With the hospice team comes a certified nurse's aide, the nurse, of course, the medical director, which is a physician that's willing to make house calls and is available on call 24 hours a day, 7 days a week, social work, and spiritual advisor, which is a chaplain. With that support, we can provide respite services for folks that are at home where we need a caregiver needs a break. We can provide the respite services through the volunteer or the certified nurse's aide, or teaming up a bunch of professionals to come in to give that break to the caregiver. With our team, being on hospice care, a patient may have been in and out of the hospital several times in the past few months or weeks, and patients may have decided that they no longer want proactive services and they want to just die in the comfort of their own home and receive just comfort care. Hospice care can be provided at home, and you can get as much care as you can at the hospital, with the exception of life support and life-sustaining treatments. So if patients want to have just comfort care at home and die in the comfort of their own home, hospice is the avenue to take. With hospice also is a bereavement support. We have bereavement coordinators and bereavement supports, whether it's a social worker or chaplain, that can provide individual bereavement supports at home. They can do visits, they can send out mailers, we send out flyers, and we also have memorial services twice a year. We have one close to Christmas, which we did one this year, which was called Dear to Our Hearts, on honoring those that have passed away. With that, we had a memorial tribute where they took a token home and were offered the opportunity to come up and speak a moment about their loved one. We also have a memorial service scheduled for May of this year, where we're going to, around Memorial Day, memorialize our loved ones as well. We also offer support groups where we get better and do better with the support of groups, those that are going through the same exact things that we have. With bereavement support, we help educate families and loved ones that no one grieves the same. We all have a different relationship with our loved one, and so because of that, we grieve differently, and hopefully that we can help families understand that just because we're not behaving all in the same way, we are all grieving, and hopefully we're healing together. So that's what bereavement supports is all about, and we do offer that for 13 months following a patient's death. That is something that you would not get unless you were under hospice services. Our hospice team is there to help walk the path with family members and loved ones, because this may be the first time they've ever experienced losing a loved one, and so the hospice team together can help provide that support, hold their hand, and help them walk that path through this journey from this life to the next.